We have three great panelists, and their stories are complex, engaging, and powerful, and we're honored to be able to hear from them. There's health disparities faced by border and immigrant communities. So how did your backgrounds and your home communities affect your experiences in the immigration and education systems?
To kind of give a background and to my answer, I was born in Mexico, in la Ciudad de Mexico, and I grew up in Washington State. So it was actually a very small rural agricultural town called Brewster. And I grew up around orchards that gave like beautiful blossoms, but also gave us a lot of pesticides in our everyday living.
So I think that many times whenever we talk about these levels of poverty and violence that people are talking about, like I can tell you that within me, I was stabbed in my head, I was shot twice in both of my arms, I lost my brother when I was 5, and experienced a hurricane, and it is things like that that push people to migrate to another country. So to say that my mother made a crime to come to this country while she was running away from those things, I think that is a mistake. The reason why I'm able to navigate this higher education system is because of the sacrifices of my mother.
I migrated with my parents at the age of 7. I remember crossing the desert. I believe it took us 3 days because of the nature of the things that we have to go through. And we left for the very same reasons that my fellow panelists here are articulating. A critical issue of navigating multiple systems, because it doesn't even have to be systems. Sometimes it's in fact identities. Whether it be LGBT, sometimes disability. And so I think it's important for us as we have this conversation, and I'll try my best to frame it such that we focus on this intersectionality of issues.
There was a raid that took place in my hometown. And this is one of the raids that took place, there was one of the 4 that took place while I was still living in Brewster, Washington. And one of the things that I saw was the inaction of the institution, not knowing what to do when the students were going to go home if their parents were there, and 2, not knowing what the institution was going to do when the students returned, if they returned the next day. So that led to a lot of like mental instability and a lot of anxiety and a lot of fear for students to even come to school because they didn't want to leave their parents thinking that they were going to see them when they came back.
To be able to tell you a little bit of context of what it means before we get into even the education system, I think that many times we tend to criminalize the story of our parents for bringing us here, and I think that in itself is the biggest mistake that we can make, because our parents are not criminals. In fact, they came to this country to give us a hope, to give us a reality that they themselves could not be able to fulfill, which is navigating a system that is very complex.
It's hard to deny the fact that these experiences come with challenges, particularly when you're navigating multiple systems. Right? I became a legal resident at the age of 18 when I was being awarded the court. But that meant that I was in foster care. As somebody that was also an undocumented immigrant, it meant for me that I couldn't get access to health insurance like everybody else that was in foster care. Why? Because Medicaid law says we can't. And these are things that were new. These are things that people had to learn. But our experiences, I think, can be powerful. And I think it's important for us to frame the discussion and build consciousness around those.